My experience of using research and evidence for policy and practice is in our work with the 2 Africa constituencies to the Global Fund to Fight AIDS, Tuberculosis, and Malaria Board. There are 2 representatives from Africa to the Global Fund Board, one from East and Southern Africa and one from West and Central Africa. And typically before board meetings at the Global Fund, which happen twice a year, there can be upwards of 1,000 pages of documentation and reports. And while the board members and their delegations and committee members are experts in their own right, they also are sometimes ministers of health and people with big jobs who are called upon to respond to many demands on a daily basis. So having to go through thousands of pages of reading material in advance of board meetings and then additionally triangulate it with other sources of information is a daunting challenge, to say the least. So that's where our organization has come in to help support the African leadership to the Global Fund Board, both board members and committee members, as well as their delegations, to help them respond more meaningfully to the volume of information that they're expected to be familiar with, and to help them make sure that they're making best use of the information available, both from the Global Fund Secretariat and from external sources, as well as comparing it with information that's available from regional and continental sources. Our role is a temporary one, so the policy analysis and supportive research that APHRC has been able to conduct over time, we hope has improved the participation and improved the robust participation of African leaders to the Global Fund Board and enabled them to rise to a higher level of participation, considering that 60% of Global Fund resources flow to Africa. Africa absolutely has a responsibility and an obligation to make sure that they are full participants in deciding how resources are used in their countries. There are 2 board members at the Global Fund Board representing 47 countries of sub-Saharan Africa. So it's crucial that the board members have a strong command of the realities, both epidemiological and in terms of health financing, that are happening in all of the constituent countries, and represent the Africa in a meaningful way. One of the barriers that we've experienced is managing the consensus building process across the 47 countries of sub-Saharan Africa. My research colleagues and I have worked hard to make sure that the context of each of the countries are represented and integrated into the positions to the best of our ability. While we are engaging in objective policy analysis and research to support the constituencies of the Global Fund Board, we're also very cognizant that it's not possible for us to be aware of the realities in all of these countries. And therefore, we really rely on strong communication mechanisms to make sure that the positions are truly reflective of all of the countries of sub-Saharan Africa.